My name is Srini Reddy Gangasani. I'm an invasive cardiologist in Atlanta, Georgia. I work in a cardiology group of 16 members in suburbs of Atlanta. I'm also chief of medicine at Gwinnett Medical Center, and I'm a president of Georgia Indian Physicians Association called GAPI. I've been working with Unicity with about last 6 to 8 months, and it's been an incredible experience for me personally and then also to my patients. Initially, I started using Yasan myself before I gave it to anybody else, and I tried for 3 to 4 weeks, and it's an excellent improvement in my cholesterol. I lost about 4 to 5 pounds within 3 weeks. So I felt comfortable that I could use it in my patients and my family. So then my wife started using it, and then I started using it in my patients. So far, I've seen wonderful results both for diabetes as well as the cholesterol. Obviously, heart disease risk is going to go down, but it's a slow process. So we're going to see a few years down the road what Slim has done to my patients. But from India point of view, India has a lot more heart disease. Indians anywhere have about 3 to 4 times more heart disease than anybody else in the world. So knowing that there is so much risk involved, I think we need to do things right from the beginning so that we don't get to the disease in a later part of our lives. In Indians, when the disease comes, it comes in early, it strikes hard, and most of them present with a sudden death in their 40s and 50s, which is a lot more what we call like a malignant cardiovascular disease in Indians. Working with BiosLife Slim has tremendous benefit with the sugars as well as the cholesterol, which in turn should make our risk to go down significantly. In India, I think the diabetes prevalence has been very high, and incidence has been going higher and higher. And when you look at the data from all over the world, I think in India, the new onset diabetes patients are a lot more than any other country. Having these two products, BiosLife D and BiosLife Slim, both of them will benefit our sugar levels to go down. And in fact, in the studies, it has decreased the hemoglobin A1C, which shows how your blood sugar has been in the last 3 months, up to 2%. That is almost using a couple of medications when we use the treatment for the diabetes. So by using this, I think diabetes is a precursor for the heart disease. So I think by treating diabetes, I think we are indirectly treating the heart disease risk. I'm really happy that Unicity has brought the product to India, and I think all of us have to work with our friends and families to make people use of this wonderful product to get our lives better and our risk better, and as a country we should benefit from this wonderful product.